I want to introduce our next speaker, who is Jens Loven from Oslo. Dr. Loven, I believe you are a specialist in ENT and head and neck surgery based in the lovely city of Oslo. And you're going to cover today your 25-year research, I think, and plus. I actually did some research and read around some of your work that this began in the early 90s, didn't it? Early 90s. I read about your trip and your time over in New York, where you brought back some of this treatment. So one of the first, if you like, founding fathers of the treatment using botulinum, which we would know of in a lay audience as Botox, for the treatment for dystonia. And on this presentation, you're going to cover the use of Botox botulinum toxin for the treatment of laryngeal dystonia and your 25-year journey in that. So with that, I'll let you take the stage, Dr. Loven.
Thank you very much, and thank you for the invitation to speak in your meeting.
Professor, just sorry to interrupt. Don't hesitate to tell me when you need me to display the next slide or to play the different videos.
Yes, I will. Thank you. Since 1991, we have treated patients suffering from spasmodic dysphonia with botulinum toxin injections. I have worked together with Professor Trond Garnes. He was a neurophysiologist at the ENT at the neurological department Rikshospitalet in Oslo. Next slide, please. Next picture. Yeah, dystonia is a condition characterized by involuntary muscle contractions, and dystonia can involve any voluntary muscle. Usually it worsens with fatigue, physical and emotional stress. Next slide, please. Next slide. Yeah. Dystonia can be primary without any obvious cause. Maybe it's a dysfunction in the basal ganglia in the brain. If you had a primary dystonia, it's usually onset, especially by patients with spasmodic dysphonia between 40 and 50 years, or you could have a secondary dystonia, secondary to neurological diseases as Parkinson and Huntington, and also to special types of drugs. You can get a secondary dystonia. Next slide, please. Vi se, nå kom den opp igjen der. Spasmodic dysphonia, that is a focal dystonia. It's an affection, a dystonia in the muscles in the voice box, in the larynx. Other types of focal dystonia, it's one single muscle group affected, is blepharospasm. That is affection in the eye muscles or torticollis. Next slide. In this picture, you can see the muscles in the voice box, in the larynx. It's 9 small muscles, and 8 of the muscles is closing the vocal cords, and only 1 is opening the vocal cords. By closing the vocal cords, you can take the next picture, please. Also, adduction. It's adduction, that means closing. With adduction, with D, the vocal cords moves together and make sound. By abduction, the vocal cords separates and you inhale air into the lungs. So adduction and abduction. And most of the, over 90% of the spasmodic patients have an adduction dystonia. Maybe you can start this video and then you will see that you see these white bands, that is the vocal cords, and it's coming air from the lungs between the vocal cords, which vibrate and make sound. So this is normal patients with normal vocal cords. It's opera singer, so it's possible for you to start this video. That's a start. Now, You can start the video. Can you take the arrow down on there? Yes, on there, and start it now. There, yes, and try to start it. No. Try again. There, yes. Try to
Sorry, I need to play it like that, otherwise I cannot.
uh, no, it doesn't work.
Yeah, I think so. No.
Okay.
It was.
Sorry for that.
Yeah, it was working when I tried when receiving your presentation. Sorry for that.
Yeah.
No, no. Sorry. Do we go on?
Yes, go on. Sorry for that.
No, it's my.
So, the word dysphonia, that means voice disorder. It is easy to mix this word together with dystonia. So dysphonia, that means voice disorder, and dystonia is another part. So next picture. The first who described spasmodic dysphonia was Traube in 1871. He called this nervous hoarseness. Next picture. It's several types of spasmodic dysphonia, and as I said before, 90% of the patients had an dystonia in the muscles which close the vocal cords, and the voice is going to be hoarse, jerky, and groaning with pitch break. And next picture. You can have other rare types of spasmodic dysphonia. It's an abductor dystonia, that is affection in the muscle which open the vocal cords, and these patients had more a whispering voice. And you can also have dystonia in both in the muscles which open and close the vocal cords, mixed spasmodic dysphonia. Next picture. Yeah, this is a video of a patient with an abductor dystonia. I think if you can try to.
Loven og sola kjeklet opp hvem av dem som var den sterkeste. Da kom det en mann gående med en varmekappe om seg. De ble enige om at den som først fikk mannen til å kaste kappen, skulle gjøre.
Yeah, definitely. This is a classical spasmodic dysphonia, an adductor type. By spasmodic dysphonia, it's curious that by laughing, crying, and singing, the voice is often unaffected. So next picture. During the years, they have tried a lot of treatment for spasmodic dysphonia: speech therapy, psychotherapy, acupuncture, hypnosis, pharmacotherapy with only limited effect. Next picture. Dr. Dido in 1976, he tried to operate the patients. He cut the nerve to one of the vocal cords. 60 to 70% of the patients had, recurrency with spasmodic dysphonia without 3 years. So that was not a very successful treatment. So next picture. Andy Blitzer and Mitchell Brin at Columbia University in New York, they were the first who treated spasmodic dysphonia with botulinum toxin injections. And that was a revolution for treatment for patients with spasmodic dysphonia. I visited Andy Blitzer in 1990 and learned his technique, and I had much contact with him during the years. So I have used all the years his technique. So next picture. This is the injection technique for over 90% of the patients. We had this adductor dystonia, which you heard on the video. You have a Teflon-coated injection needle. This is a picture of the neck in the front. In the end of this needle, it is an electrode. You can take the neck picture. And here you see this is connected via an EMG recorder. And when you are in the right muscle in the vocal cords, you can see a signal on this EMG recorder on the screen here. And you inject a small amount of botulinum toxin in each vocal cord. When you had learned the technique, it's very easy and it takes only 5 minutes. So when you inject botulinum toxin in the muscle, the voice is going to normalize within 24 to 48 hours. Next picture. So this is the technique we use when we inject in the only muscle in the voice box, in the larynx, which open the vocal cords. It's a very rare type of dystonia. It's very difficult to treat these patients, difficult to diagnose them, and to inject and find the right muscle in the backside. This is the backside on the larynx and the voice box. You can see the arrow, the black arrow. And they had to try to find these muscles, this muscle, but that is easy, and that is not easy. And it's a very few patients with this type of spasmodic dysphonia. So next picture. Yeah, between 1991 and 2016, we had treated 182 patients with botulinum toxin injections. And it's another report. It's more women than men, and the mean age of symptom onset was 48 years. Next picture. 100 of these patients got spasmodic dysphonia after a stress situation. It could be serious disease. It could be problems in the workplace. It could be divorce and difficult stress situations. 67 patients got debut of spasmodic dysphonia without any obvious cause, and 15 got spasmodic dysphonia after an infection in the throat or in the lungs. Next picture. This is number, a moment, please. This picture shows the distribution of the diagnosis. The blue part of the circle consists of the patients with the common, also the adductor dystonia, the adductor laryngeal dystonia, which is 90%. And the three other types of spasmodic dysphonia, it's only a few patients. So the adductor type is over 90%. Next picture. And this is the results of the treatment. If you have a primary spasmodic dysphonia, also without any other neurological symptoms as dystonia and then in the neck or trembling voice, and so it's excellent results for 67 of the patients and very good results for 30 patients. I think the 8 patients with poor results, I think maybe the diagnosis is not correct. It's not easy to diagnose these patients, all the patients. So the other group, this is a little older patients with symptoms debut at 62 years. These patients have spasmodic dysphonia, but they had also dystonia in the neck muscles and in the face. So the results for also these patients are good, but not as good as the patients with only other the primary spasmodic dysphonia. Next picture. So I can say that if you treat spasmodic dysphonia with botulinum toxin and have a good experience with that, I think 46% of the patient had an excellent response. 36 had a good response with improved voice, and So it's a total of 82% of the patients had a very good response. Next picture. The duration of voice improvement is between 6 weeks and 8 months, mean 3.5 months, and then the injection have to be repeated. 8 of the patients got spontaneous remission of symptoms. They had very long response in injections, and after 3-4 injections, their voice normalized, and they have no more problems. 2 of the patients got normal voice after only 1 Botox injection. I think they didn't have spasmodic dysphonia. Maybe they had another muscular voice disorder. So next picture. I have during the years treated, I have done more than 5,000 injections in the vocal cords. I have never had a serious side effect. Most of the patients had a breathy voice the first day after Botox injections, mean 9 days. And most of the patients had a mild sensation of swallowing problems the first week after Botox treatment. So next picture. Yeah. 114 of the patients, 62%, got worse voice in stress situation. That is, most of the patients with voice disorder have a worse voice in stress situation, not only the patients with spasmodic dysphonia. Next picture. You can try. This is a patient with spasmodic dysphonia, and it's before and after. This is before treatment. I don't know. It's possible to start it. Yeah. So you can hear the voice is jerky, very pressed and groaning. This is also next picture. This is after treatment with Botox.
Oyvind och Sola käcklade om kammaren så var den starkaste. Då kom det en man gående med varm frack på sig. Det var samdom att han som först kunde få man till att dra av sig frackar skulle gälla för det starkaste av det.
Yeah, next picture. So that's a very good result for a patient who had a very invalid voice before treatment. So as a conclusion, I can say that if you had a focal adductor spasmodic dysphonia, also without any other dystonias in the head and neck, it's excellent response to botulinum toxin treatment. Mean improvement of the voice is 3 months, or usually symptoms debut between 40 and 50 years. Next picture. If you had a spasmodic dysphonia with other neurological symptoms as voice, a trembling voice, and dystonia in the neck, yes, in the neck, you have improved voice, but not normal voice. But the results are also good, and these patients have symptoms debut when they are over 60 years. And next picture. If you had the rare spasmodic dysphonias with mixed vocal dystonias and abductor type, it's very difficult to diagnose and difficult treatment. So next picture. This is a picture made by an artist. He got a video of a patient and made this illustration. And I think this picture tells us more than many words. So at last, I will say that it's important when you treat spasmodic dysphonia patient, you need to have many patients to get experience with the treatment. It's a teamwork between an ENT doctor, a neurophysiologist, and you also need a good speech therapist. So I think this treatment, especially in small country, have to be centralized so the doctors can have enough experience. You can't treat a few patients in the year, then the experience of the treatment should not be good enough. Thank you very much.
Thank you so much, Jens. And we do have, if you're okay to stay on, quite a few questions, actually. It's raised quite a few patient questions. So first one really to combine two questions is, how common is dysphonia, or is it considered to be one of the rare forms of a rare disease itself? So one of the rare forms of dystonia.
It's an investigation from United States, I think, from the 1980s, and I think I had a picture of that. I think it's about with spasmodic dysphonia. I think it is about 50 patients per 1 million. So I think in Norway we should have about maybe 300 patients with this disease.
Okay.
So yes, so it's a rare form of dystonia, and I think also many ENT doctors don't know anything about it.
Okay.
So I worked in 1 day a week in the National Hospital, National Center for Logopedics in Oslo. I started there in the middle of 1980s, and to this center it came patients with spasmodic dysphonia from all parts of Norway. And I started to be interested in this curious disease and started to read about it, and heard about Blitzer in New York, who started this treatment with the botulinum toxin. So it's a rare disease, and it's a rare speech disorder, and therefore it's important, very important that the the treatment have to be centralized in a few clinics to get the good results.
So, I mean, a question related to that, should a patient, so they probably will go through their GP practice first, they'll go through primary care, should they be referred to a neurologist or an ENT specialist for this?
Yeah, I think usually a patient with these problems, they are sent to an ENT specialist. And I think I had several speeches about this in our national meetings. So I think most of the ENT doctors know about this, and they will send this patient to, I think we treat in Norway, we treat this patient at the hospital where I worked in Lovisenberg, and also in the National Hospital, Rikshospitalet, and also maybe in Trondheim, 3 places. So they have to be sent to one of these 3 centers for treatment.
Okay. And I think you mentioned a cohort of about 300 people. I think you mentioned it at your hospital. I think it was 300, wasn't it? What percentage are women of that population?
The percent, I think it was in this group of patients, about 180, I think it was 67% of women, and yes, 67. So that is also the other reports from articles from other parts of the world. It's the same. It's more common by women. So yeah.
Okay. Do you know why? Is there any etiology behind that?
No, I don't know.
Okay.
I don't know.
Okay.
I think there are. I think it's a group of patients out there who doesn't go to the doctor for these things.
Yeah.
So I think maybe I think especially men, maybe. So I don't know what is the reason for that. But it could be. I think I have treated. I think I was the first to start with this treatment in Norway. I got many patients. So I think I have about 80% of the patients in Norway. So why it's more women? It's maybe other can answer this question. I don't know.
Maybe you're implying maybe more women present to you, but
Yes,
there
yes,
may be an
yes,
iceberg of men who are not presenting,
yes,
which is you know, without generalizing, is true of other disorders, isn't it? That a lot of women present quicker for
yeah.
help, don't they? And we know there's data behind that. And I'm going to ask you one more question, but I know there are lots of questions backed up. But in the interest of time, I've got one more for you. And if you're all right, we're going to take all these questions and maybe give these to you for you to answer for the delegates outside of this, if that's okay. So one more question is, why do some patients not respond at all to this therapy?
I think that it's difficult to diagnose these patients, some of the patients, because you have to listen to the voice, and you have to work together with a speech therapist, and sometimes you are not sure if the diagnosis is correct. And in these cases, I always try to treat them and see how the results is. So I think when you don't respond, I think the diagnosis is not correct, right? I think if you have the classical spasmodic dysphonia, you should respond to the treatment if you do it in the right way. So I think it's because that the diagnosis is not correct.
Okay. Thank you so much. And honestly, we have a load of questions banked up, so we will store them. A number of the questions, actually, I'll just give you an insight relating to breathing problems and the impact perhaps that this has on breathing problems as well, and on some of your studies looking at control groups as well within it. So we will save those questions. I've just given you a kind of insight into what's coming through, and I'll make sure that Dystonia Europe pass these on to you if that's okay after the event. Okay.
Yes.
Thank you so much. I've again enjoyed